Welcome to Clinical Instructor and Clinical Staff Training. Dr. Tess Myers is the Program Director, Mrs. Sarah Barnes is the Clinical Coordinator, and Ms. Melissa Whitley is the Allied Health Department Chair and Radiology Instructor. Today we would like to define our program's purpose, your role and expectations as a clinical instructor, and break down how comps should be graded. Objective 1. The Radiologic Technology Program at Louisiana State University Alexandria is designed to prepare graduates who are competent in the art and science of radiography. The graduates of the program will receive an Associate of Science degree in Radiologic Technology and are prepared to complete the National Certification Examination administered by the American Registry of Radiologic Technologists. As you know, students are required to rotate through multiple education sites in order to see a variety of exams and be exposed to different equipment and workflow examples. Students are only allowed to be in assigned rotations. They are not allowed to stay beyond their clinic hours because they must not exceed 8 hours a day. Additionally, students should remain in assigned areas. They should not be used to fill staffing shortages. Students rotate through several shifts to gain experience and prepare for the workforce. Each shift includes a 30-minute lunch or dinner break. You should have a copy of the current student handbook in your department. Forms, such as incident reports, can be found in the handbook, as well as other pertinent information about the program and student responsibilities. To clarify, LSUA never lost programmatic accreditation with JRCERT. The program was placed on probationary status because of low first-time pass rates on the registry. LSUA has regional accreditation and the radiology program has programmatic accreditation. The program can exist without programmatic accreditation as long as the university maintains regional accreditation. LSUA meets all standards required of JRCERT, except for first-time passage rate on the ARRT registry. Objective 2. Clinical Instructor Expectations. JRCERT requires that all clinical instructors have appropriate qualifications. The clinical instructor should have a minimum of 2 years of clinical experience, be proficient in supervision of students, and be ARRT credentialed. Here you can see the difference between a clinical instructor and clinical staff. The clinical instructor takes the place of program faculty when they cannot be present in the clinical site, and should have an understanding of the program mission and goals, and they should also serve on the advisory committee to aid in planning and assessment for the program. Both clinical instructors and clinical staff are able to evaluate students' competency levels. It is important to remember that students do not know everything, regardless of what you think they may have already learned. There is so much information coming at them so quickly, they often get overwhelmed. Please avoid comparing them to other students or talking about students in front of students, as this is discouraging to them. They are learning new things and new ways from every tech they encounter. Most of them really are trying and want to learn. Please be patient and help them. Constructive criticism is part of the job, and students need to be able to handle receiving it. However, remember, it's not what you say, but how you say it. It may help to remember PSP, praise, suggestion, praise. Tell them something good or positive from the interaction, then something they did incorrectly and how to improve, then another positive statement. Framing our criticism correctly can make all the difference in how it is received. Some complaints from students are listed here. The students should not be talked down to. All students should be treated the same, and please avoid negativity around the students such as, not sure why you're going into this field. Another complaint is grading comps is sometimes very subjective depending on the tech grading them. Hopefully, the next few slides will clear up any confusion with how to grade comps. Objective 3. Paperwork. The students have lots of paperwork. It can be a hassle, we get it. However, to maintain compliance with JRCERT, we must have supporting documentation for program effectiveness, therefore, the paperwork is necessary. Students have a set number of comps they must get each semester. They cannot comp unless they have passed their simulation exam in class. Before they are competent in an exam, they must have direct supervision, meaning you must be there the entire time they complete the exam. After being competent on an exam, they perform them under indirect supervision, which means you have to be near, but not directly over them. At no time should a student ever repeat an exam alone. You must watch them do the entire repeat. Students can get a score of 2, meaning nothing was wrong with that section of the exam, all the way to an automatic failure, meaning it was a serious error. The automatic failure reasons are listed at the bottom of every comp form. A student must make a 90 or better to pass the comp. Students are graded on their ability to evaluate the request, room readiness, equipment manipulation, positioning skills, and patient consideration. If, for example, there is an exposure error, and the student cannot, in a timely manner, figure out why it will not expose, then it is an automatic failure. However, if there is an exposure error, but the student is able to figure out the error and correct, it is not an automatic failure. The rest of the comp form grades the students on anatomical parts, positioning, rotation, etc., proper alignment, anatomy, clipped, correct centering, technique, S numbers, whether or not they can set a technique, identification, marker usage, patient information, and radiation protection, shielding, repeats, or collimation. If a student has to repeat the exam, it is not an automatic failure unless they have to repeat more than twice. The final component of the comp form to grade is image critique. If you do not have time to go over the image and anatomy, please leave this portion blank. If you fill it out, we think you went over the images and asked the student questions. If you leave it blank, we know we need to complete this section with the student. For any deductions, please explain on the back of the comp form so that we can adequately judge the comp and provide remediation as needed to the student. Point deductions without explanations make it difficult to remediate.
Just a few images to understand how they might be graded. In this image there is a marker, and technique looks good. The foot does need to be rotated medially more, but it is not enough to repeat. So grading this comp, I would take off 1 point for rotation, then note that the foot was not rotated enough. For this image, there is rotation, a chin in the image, and it needs to be repeated. So the student would lose a point for rotation and a point for positioning because the chin is not elevated enough, which gives them 0 in row 6 column A on the comp sheet. Additionally, they would lose 1 point for repeating the image. In this image the L5S1 junction is not open. If the student did not use an angle, they would get an automatic failure for incorrect angle. If they used the correct angle, then they would lose a point for positioning, as well as a point for rotation, and possibly a point for a repeat if it was needed. In this image, the petrous ridges are demonstrated inferior to the superior orbital margins and the dorsum celli and anterior clinoids are demonstrated within the ethmoid sinuses. The chin was not tucked enough to position the OML perpendicular to the IR. To correct, tuck the chin until the OML is aligned perpendicular to the IR or move it the full distance demonstrated between the petrous ridges and the supraorbital margins. So the student would need to repeat and lose a point, as well as a point for positioning.
Moving on to the evaluations. Providing timely feedback is essential to seeing changes. When evals hang on the view box until the next semester, it is no longer useful. We need your feedback. The students need your feedback. We need to hear the good and the bad. If you have something to say about a student, please, in a respectful manner, write it on the evaluation. If you give them all 4s and 5s and write nothing on the back, but they did a terrible job, then we cannot correct or remediate. Please evaluate them honestly, and make sure the evaluation reflects their efforts and skill level. If you give them good evals, but complain to us about how bad they are, it is difficult to correct because all they see is a good evaluation. We hope this helped clarify expectations of clinical instructors and staff. We take pride in our program and strive every day to make it better. While we are making every effort to correct the poor first-time pass rates, we do overall have a good program. We want to produce competent technologists who are an asset to their employers. We need your help to do that. Please invest in these students as they will be your coworkers one day. We thank you for your time and effort, and we value your input. Please let us know if you have questions, suggestions, or concerns. Thank you.